This is Gerry Ross. I'm a physiotherapist from Georgetown, Ontario, and I founded Ross Physiotherapy Solutions here in Georgetown. Our YouTube videos are intended to help patients who are working with our clinicians get as much benefit out of their home program as possible, and to act as a resource for the health and safety representatives who we have trained through some of our programs in the community. This information should not be used without formal training or ongoing supervision from our staff or a government licensed healthcare provider with expertise in the area of musculoskeletal problems. These maneuvers are intended to serve two purposes. One, to preserve or perhaps increase your comfortable range of motion that's available in your joints and soft tissues. And also, if you aren't ill or suffering, they increase your body awareness and alert you to early signs of deteriorating joint and soft tissue health, as noted by the reduced pain-free range of motion that you may have. And if you notice this, you may wish to see a physiotherapist or physician to have it evaluated further. General principles: always start from as comfortable a position as possible. My neck, for example. It's comfortable now. Put distracting thoughts out of your mind and focus on what your body is telling you as you do the maneuver. Anticipate the development of the stretch sensation before you feel it being felt. Stop moving when you feel the stretch begin in the body region that's affected, and focus your mind on causing the area to feel less stretch through relaxation. And generally hold the position for about 10 seconds. Motions can be repeated if further relaxation is possible, or if the movement is new and the technique is likely to improve with each repetition. So let's get started. This is called a chin tuck, useful for combating the very common head forward posture that is the result of the relentless force of gravity. What is done is tall posture, string through the crown of your head going up toward the ceiling, making your spine as long as possible, gaze into the horizon, and move your head back. It's a small movement. The chin does not go up or down. And you go as far as you can and just begin to feel a stretch. It may be here, it may be here, and it should be done gently for about 10 seconds. And if you have sensitivity here, it can generate a headache. So this maneuver should be done delicately if you have that kind of sensitivity. Side bending of the neck. Nice tall posture again, like there is a line on the crown of your head pulling you up toward the ceiling. You're going to take your ear in the direction of your shoulder without rotating your head left or right. It can be done without any guidance from your arm, or you can have your arm resting gently on your head and guiding the movement. Not pulling, not adding force, just guiding. Like all maneuvers, stop at the beginning of the feeling of stretch and relax for approximately 10 seconds. And this typically is felt on this side of the neck, and occasionally can be felt as a slight jamming sensation here. Be careful with that one and don't be aggressive. Seek treatment if it doesn't resolve. Side bending combined with forward bending. Rotate your head 45 degrees into one direction. Take the arm on the side that you're rotating toward and place the arm directly up in front of the face. Use the arm to guide the head forward in a diagonal path, creating a sense of stretch on the opposite corner in the rear of your neck. Like every other maneuver, focus on relaxing and allow your body at least 10 seconds to respond to your brain's effort to relax the area. This can be done on the other side as well. Forward bending to stretch both sides of the neck at the same time. It is important that you curl from the top downward, like this. Chin's tucked, roll to the point of a slight pull, focus on relaxation for approximately 10 seconds. Use breathing from your belly and avoid the mistake of head being poked forward followed by bowing down. You'll get more benefit out of curling from the top down. Here, we're going to address the round-shouldered posture. What's going to happen is you're going to draw your blades together. The hands are going to be clasped. The elbows are not going to be the lead body part. They are going to stay relaxed. And the head is going to be pulled toward the ceiling through the crown, and the shoulder blades will draw back toward one another. Once again, holding for approximately 10 seconds. And avoiding the common mistake of the head being pushed forward as the blades come together. You don't want to do that. And avoid the common mistake of your fingertips and elbows being the driving force for your shoulder blades to come together. You don't want that either. That'll put stress on the front of your shoulder joints. You want to have your hands clasped and the elbows relaxed and the blades coming together. Now we're going to stretch the upper back by pulling the arm across the chest. Here what you're going to do is you're going to use the hand opposite to pull the arm toward the chest, and once it reaches the chest, across the chest without turning your torso. This is useful to alleviate irritation in the upper back, but I'll caution you not to use it excessively because it does cause elongation of muscles that are already, in many people, excessively long. This is useful in relaxing the irritations that may occur between the shoulder blades. But again, the maneuvers shown earlier of tucking your chin and pinching your shoulder blades are a better way to prevent this irritation from happening in the first place. But pulling your arm toward your chest and then across can provide temporary relief in some cases if there is soreness between the shoulder blades. A maneuver to reduce irritation between the shoulder blades by restoring the ability of that area of the spine to straighten. Take your hands and put them around your neck gently, and they're going to keep your neck from bending backward. Bring your elbows toward one another to make it more secure, and then raise the elbows up toward the ceiling, and that is going to cause your upper back to be less rounded. From the beginning, the relaxed posture, hands around the neck to reduce its ability to bend backward, and then ease the elbows up and think about your chest being stuck out. And this will cause a reduction in the curvature of the spine that lies between your shoulder blades. And repeat it intermittently throughout the day and over a number of weeks. This can be very helpful in reducing recurring sensitivity that happens between the shoulder blades. And like most maneuvers that I suggest for this purpose, you'll hold the position for approximately 10 seconds and focus on trying to relax the area where you feel your body telling you that it is under some degree of stress. Exercises for the torso and shoulders combined, useful for people who bend forward repeatedly or sit at desks for prolonged periods. Take your hands and clasp them together. To do a combined stretch for your rib cage and forearms, you can turn your palms to the ceiling and then reach up and to one side. Feel a stretch throughout in my case, the left side of my body. Have a long spine at your neck. And again, like most maneuvers, focus on the area that you feel the greatest pull in and endeavor to relax that with mental focus. For about 10 seconds, return to the midline, and then the other direction, similar pattern. Look straight ahead, long spine, make the distance of the curve, in this case my right side, as long as possible. A useful maneuver for maintaining flexibility of the chest and combating a rounded shouldered position is clasping your hands behind your back, making your spine long by taking the crown of your head to the ceiling and bringing the shoulder blades together in that direction with an effort that creates a pull, typically in the chest and the front of the shoulder. Like every maneuver, it's a moderate pull that you focus on relaxing over the period of about 10 seconds. Very good. Gentle stretches for the wrist, hand, and forearms. First one, to stretch the front of the forearm. Take your hand and put your palm facing away from you. Take the other hand and gently lay it in front of the fingers of the hand to be stretched, and then start from a stretch-free position and ease back toward you. Like every maneuver, focus on relaxation at the point where you begin to feel the pull. The hand does not have to be raised in front of you, as that can cause a little bit of tiredness in the shoulder, so you're quite capable and appropriate to have it down by your side as well. Stretch for the rear of the forearm, the area that's commonly affected in tennis elbow, is place your palm facing the floor, move the wrist toward the palm, take the other hand and assist that movement further. The forearm and arm do not have to be horizontal, they can be toward the ground. Execute the maneuver to the point where you feel a slight pull, typically in this side of the forearm, although occasionally only within your wrist. Whichever sensation comes to you first, stop at that sensation, focus on relaxation, and give your body about 10 seconds to respond to your effort. If you find with this maneuver you get tingling in your hand, particularly in these fingers here, you may benefit from having a consultation with a healthcare professional such as a physiotherapist or a physician, and you would put this exercise on hold until you acquired that information. Some exercises that are helpful to the low back region include standing side bending, in which case you stand with equal weight on each foot, and then you ease one hand down your leg, anticipating the development of either a pull on the long side or a bit of a pinching or blocking on the short side. And like every maneuver, relaxing and using your mind to focus on reducing the strain or blockage feeling wherever it may occur for about 10 seconds. This can be adjusted to do more than the low back and do the low back, rib cage, and shoulder by using the arm on the long side and stretching that arm up and sideways. When you're doing this exercise, try not to bow forward or backward, but stay in a straight line when viewed from the side. Again, the instructions are similar in that you go to the point of feeling a pull, wherever that first point of feeling a mild pull may be, that's where you stop, and you focus mentally on relaxing that area for approximately 10 seconds. If you have an occupation where you have to bend forward intermittently, it's appropriate and helpful to bend backward for just a moment or two after bending forward to restore that balance of range forward and backward in your spine. If you have irritation in the belt line and a short duration of moderate bending backward is relieving to you, then execute it in this way. Feet wide apart, equal weight on each foot, hands on your waist, chest is stuck out, neck is long, and then you create a backward arch gently to the point of a mild irritation or pull, and stay, in this case, for a little less duration than your 10-second typical hold, as the irritation may build if you stay for too long. Return back to a regular position, ease back, and if the previous repetition was successful, you will find that the range that's available to you before you start to feel pull is bigger than the repetition allowed before. And again, when you're doing this maneuver, long neck, chest out, and then the backward bending without bending the knees if possible. Stretching the low back in a standing position, simply reaching forward toward your feet, starting from the chin, rounding the shoulders, relaxing the back, and easing your hands toward your feet can be helpful. Some people find that this is potentially alarming in that they feel that their back is going to get stuck here. I will show you an alternative to that. And then return after 5 to 10 seconds of forward bending in a reverse pattern to that which you used to forward bend. Some people find that the forward bending stretch is a little alarming because it may cause the sensation that your back is going to lock. An alternative is to lean against the wall, hold your hands, maintain a tall spine, and pull your knee toward your chest. And hold it for the duration of time that's required to achieve some degree of relaxation. Alternatively to that, you can hold on to a post and secure yourself on the post, lean back, and allow a stretch to happen through a squatting motion. And again, relax here for 5 to 10 seconds, and then return to the start position. Hip mobility in a standing position. Separate your feet. Have your feet pointing straight ahead. That would be 12 o'clock on a clock. Hands lightly on the waist. And if I want to stretch this groin, what I'm going to do is I'm going to bend the opposite knee, ease my waist toward the bent knee, tip my torso toward the straight knee, and I will create a sensation of a pull in my upper inner thigh. And like every exercise that's intended to relax, mentally focus on the area that you feel a pull, endeavor to get that area to relax, and give it at least 10 seconds to respond to your effort. Adjustments include separating your feet wider prior to commencing the stretch, and again, fine-tuning by bending the bent knee more or tipping the torso toward the straight leg, or perhaps moving the waist forward, centered, or back in order to find the more tender or sensitive spot in this muscle group. Relaxation of the calves. Place the leg that you wish to stretch behind you. Have the foot of that leg pointing at 12 o'clock. Leave the knee straight, that is on the leg that is behind you, and ease forward slowly, anticipating the development of a stretch in the upper third or upper 2/3 of the calf. When you're there, focus on relaxation. Have a chair perhaps to lean on so you don't have to worry about balance, and give yourself about 10 seconds for your body to respond to your deliberate effort to relax this area. In order to allow some stretch to occur in the ankle and the lower half of the calf, perform the same maneuver with the knee pre-bent and emphasizing squatting or bending the ankle of the rear foot as opposed to easing forward. Relaxing the back of the thigh. From a standing position, Step forward with the leg that you're wishing to relax. Have your heel firmly down on the ground and bent, so your toes are coming toward you. Have a tall spine, chest out, stomach out, and bow forward. The leg you're not wishing to stretch has a slight bend in the knee. The leg you're wishing to stretch has a straight knee with the heel on the ground and the toes pointed back up toward you. Keeping your chest out and stomach out ensures that you pivot at the right place and you get a pull in the back of the thigh. Avoid the common mistake of measuring success by how far down your leg you can reach your hand. That will cause a forward bending of your back and perhaps not a targeted, focused relaxation of the back of your thigh, as was your intention. Repeat with the other leg. Stretches for the front of the thigh. The front of the thigh can be stretched in two ways from a standing position. One, for the top half of the thigh, is to tighten your tummy, have the leg you wish to stretch behind you, and then ease the waist forward, and you can allow the heel of the rear leg to come off of the floor with this. Do not allow your pelvis to rotate toward the side you're stretching, but rather keep the tops of each thigh touching one another. Tighten your tummy, and that will ensure that the stretch is in the top of the thigh of the rear leg. Like every maneuver for relaxation, focus on that effort for about 10 seconds. In order to stretch the bottom half of the thigh, the routine runner stretch done in standing, hold on to your ankle, keep your thighs touching. If you can't reach your ankle, then reach the bottom of the cuff of your pant or get a belt and loop the belt around your ankle and use that. Start from a position where you don't feel a stretch in the front of the thigh, and then ease the heel to the backside using the belt, the pant cuff, or your hand, and focus on relaxing the front of the thigh. Have something to balance on so you can focus on relaxing, not have to worry about your balance. Like every maneuver for relaxation, endeavor to focus for approximately 10 seconds so that you can give the body part a good chance to respond to your relaxation efforts.